now we are talking about that junior doctors' strike, which has entered its second day. Not only is it happening before Christmas, but there is a plan for another three-day strike in the new year. That comes at the same time as Labour have come out with their new plans to tackle a record cancer waiting list. We want to hear from you on 0344 499 1000. This is TalkTV. Joining me now to discuss this is Professor Karol Sikora, Medical Director of the Rutherford Cancer Centres. Professor Sikora, thank you so much for joining us here on TalkTV. We hear in the newspapers today that this doctors' strike is going to add potentially another 100,000 people to the NHS waiting list. Is that correct?
I think so. It has a big impact because of cancelling stuff. It's not so much on emergency care, that can be sorted out. So people don't need to worry about that. But as you know, there are 8 million people waiting for something in the NHS, and this is not going to make their wait any less. It's going to make it worse. And I just think it's so sad that the dispute has gone on so long and that neither side can just sit down in a room. I'd lock them in a room, and throw away the key until they say they've reached a solution. And it's a symbol of how people in the NHS don't feel loved. I think that's, when I look at it, when I was a junior doctor, I felt loved by the whole system, by the patients, by the other staff, by my colleagues and so on. We'd do anything for each other. That's all gone in the modern world. The hours are less, much less than I worked, but the spirit isn't there, and that's the problem.
But Dr. Sikora, clearly most of the people in the NHS have reached a settlement with the government in relation to their pay. The junior doctors are sticking out for a 35% pay restoration claim that they have put forward. Why do you think, unlike consultants, nurses, other people working in the NHS, why do you think they aren't choosing to settle?
I think it's a very good question. 35% is more than any other professional group anywhere has ever asked for. And because of the numbers, it's a huge amount of the budget of the NHS to be spent on that at a time when there are so many demands. Our hospitals are falling apart. You just need to walk around. I was at a hospital yesterday in the home county. It's just falling apart. You can look at it. It's covered in scaffolding, old concrete, not fit for purpose. The paint's peeling. There's so many demands on the NHS. I think the real problem for the junior doctors is there isn't that much public sympathy for them. I mean, they're not going to be junior for long. They're going to, within 5 years, they'll be consultants, they'll have much bigger incomes, higher, well above the national average. I think that's the problem. They've got to get to an agreement, and the BMA is pretty tough at negotiating, but so are the government. Sit down and get to a solution. Stop this nonsense.
You're right, Professor Sikora. This will only be sorted out by people sitting down and talking. But we learn 100,000 late diagnoses potentially from these strikes. But we've also heard from the Labour Party about their plan to break through some of this cancer waiting list backlog. They say that they're going to double the number of CT scanners, MRI scanners. Is that where the bottleneck is in the system, in that diagnostic equipment?
It is. I read the plan yesterday from Wes Streeting, and I'm full of admiration for that guy. He didn't have a good upbringing. He was a single parent, big family, got to Cambridge for a comprehensive. He's one of my fans, by the way. And what he's proposing is exactly on the button to suggest that it's not the cancer treatment. Once you get to the front of the queue, your treatment is world class. The problem is getting even to the back of the queue to get started on the queue. The diagnostic phase is just so painful. Multiple visits, multiple cancellations and so on. And I think he's got it right. The only way to deal with this quickly, not to bother about more training of doctors and nurses, that takes forever. You've just got to use what we've got, pay overtime, keep the hospitals open at weekends, the car parks are empty, fill them up with people coming to get things done, crack the backlog that way. It's doable. It will require money, but not a huge amount of money compared with what we're spending anyway on the health service all round. So I think it's a great plan.
So, Professor Sikora, I genuinely don't know. How quickly could you double the number of CT scanners and MRI scanners? Are they readily available? Can you buy them off the shelf? How quickly could you actually make it happen and train people up to use them?
we could make the the COVID vaccine program happen amazingly quickly. Volunteers made tea, sorted out the car parks and so on. And we got through millions of people through the vaccine program. That was the NHS. Okay, it had private sector helpers on the software and so on. And it's fantastic. You can find the batch number of your vaccine on your mobile phone, even to this day. When you look at cancer, it's just sort of hopeless. It's little bits of paper, postal appointments. I mean, this is Stone Age stuff. We haven't modernized it. And I think what I'd like to see if Labour get in is a total, forget the politics of healthcare. That doesn't matter. It's the delivery that matters. And let's use the private sector. I'm sure he will if they get in power. Use the private sector. 50% of the capacity of the private sector is empty, even during the week. You can use that. You have to pay for it, but it's doable. Everything is doable. And I think a bit of imagination would go a long way instead of the doom and gloom we hear within the health service.
Professor Sikora, thank you very much for joining me here on TalkTV.